Why my dog's heart stopped beating. This is video 2 in a 2-video series that discusses congestive heart failure in dogs. In this video, I'm going to discuss coughing and congestive heart failure. Why do dogs with congestive heart failure cough? As mentioned in video 1, congestive heart failure is characterized by one or more of the following conditions. You have pulmonary congestion, pulmonary edema, pulmonary hypertension, and cardiomegaly or enlarged heart. When you have all the pulmonary arteries, veins, and capillaries congested with blood, the liquid portion of the blood will leak into the airways, the lung alveoli, the bronchus, the bronchi, and the trachea. When the water and the air mix in the airways, they will create bubbles or fluid foam that will interfere with the flow of oxygen and carbon dioxide. Dogs like you and me will cough in their attempts to clear the airways and breathe normally. What are the clinical signs of congestive heart failure in dogs? Heart murmurs or irregular heart sounds emanating from the leaking valves are the most characteristic sign. Coughing, especially at night when the heart has slowed down and unable to clear the fluid in the airways. Gagging and labored breathing. Lethargy and the reluctance to take long walks. Enlarged abdomen and the edema around and below the hock joints. Syncope or fainting. How to interpret radiographs on X-rays. Before we look at a few X-rays with congestive heart failure, let's look at how to interpret X-rays. The density of an object determines its opacity or whiteness on an X-ray or radiograph. Bones have the highest density and opacity, 100%. Bones have 0% transparency. Air has the lowest density and 0 opacity. Or air has 100% transparency, like I can see now through the air. On an X-ray, bones appear white and the air appears black. Other body organs have opacities in between white and black. This is an X-ray of the normal chest in a dog. Here. Okay, that's where we are. Okay, I looked at this X-ray area, right? This is the X-ray of a normal chest of a dog. Right. As mentioned earlier, you can see you have very clear lungs there. And the heart looks normal. Now X-ray of the heart and the lungs. This is an X-ray of a dog with its severe cardiomegaly, or very enlarged heart. Very enlarged heart. You can see the heart almost occupies the whole chest. The heart occupies the whole chest. Alright, maybe I should go back there and do that, okay? I'll look at this one again. Alright, this is the normal chest. You can see the black trachea there, because the air we breathe on an X-ray looks black. Because a normal heart, this is the right side of the heart, you can see it is not enlarged. This is the left side of the heart, this is the left atrium, left ventricle there, right ventricle there, right atrium there. You can see the aorta running down here, you can see the inferior vena cava here, you can see the pulmonary artery and veins there. Alright, you can see the whole lung tissue is all black because there's no more lungs. Similarly, you can see this ventral dorsal X-ray. You can see the normal heart in relationship to the rest of the lungs. Looks a pretty normal heart, right? The lungs are all black because the air we breathe on an X-ray looks black. So that's a very normal heart and lungs. All right. Now you have cardiomegaly, a very enlarged heart, right? The heart almost occupies the whole chest, right? The remaining lung tissue is not all that much. But this dog happens, although it has congestive heart failure, the lungs still pretty look good, but the dog has cardiomegaly. All right. Let's look at this dog, very severe. This dog should be coughing like hell. This dog should be coughing like hell. You can see how big the heart is, cardiomegaly. This is the right side of the heart. You can see how enlarged that side is. You can see this side how large, how enlarged it is. See how the left auricle is, how big it is. All right. Got a good portion of the lungs there, but there's a cranial portion of the lungs is all water. All right. If you can see through here, you might not see it, but you got what we call a feature line. A feature line is just a water line. It just tells you below there is water in the lungs, right? There's water lying on the sternum here, right? Feature line or indicating pulmonary edema, congestion, and hypertension, right? As you can see, the trachea is full of mucus or froth or foam right there. You can see the lumen of the trachea is very narrow, and as I said, this dog is coughing like hell. This dog is coughing like hell. It has very little amount of lung tissue that the air could be passing through, right? The heart fills the whole chest, all right? So a very bad chest of a dog. Each time I detect heart murmurs in a small breed dog during a routine physical examination, I usually notify the owner of the following accommodations. If the dog is not coughing, I ask the client to closely monitor the dog for coughing and other congestive heart signs instead of latching to put the dog on heart medication. Why do I do this? Because congestive failure is a natural failure of the heart precipitated by old age. 2. The medications available for congestive heart failure are meant to stop coughing and not resuscitate the failing heart. How do you diagnose congestive heart failure? Heart murmurs plus persistent coughing in a small breed dog are adequate signs to incriminate congestive heart failure. Chest X-rays will confirm congestive heart failure. How do you treat congestive heart failure? Strategy number 1 is remove the water in the lungs and clear the airways. Furosemide or Lasix is the mainstay medication for congestive heart failure. Furosemide is a diuretic that makes the dog urinate more, clear the water in the airways, and eliminate cardiomegaly, pulmonary edema, congestion, and hypertension. Frequent urination from furosemide administration will lead to frequent thirst and demand for water. I normally advise clients to limit the water intake to 1 or 2 times a day when the dog is eating. Strategy number 2, lower the blood pressure. Congestive heart failure leads to high blood pressure. Enalapril is a medication that lowers the blood pressure by dilating blood vessels, arteries, veins, capillaries, and thereby lowering the failing heart. The failing and weak heart is space to upload blood into. What is my congestive heart failure treatment protocol? I normally administer furosemide injection at 2.5 to 5 milligrams per kilogram body weight, then dispense the same dosage for oral administration twice a day for 2 weeks. Free recheck. I normally schedule the client for a free recheck in 2 weeks to check if the coughing is satisfactorily controlled. If the coughing is well controlled, I will advise the client to continue with the initial dosage of furosemide for the rest of the dog's life. If the coughing is not fully controlled, I will dispense or prescribe the Narapri at a dosage of 5.5 milligrams per kilogram body weight twice a day for the rest of the dog's life. It is essential to monitor and adjust the dosages of furosemide and Narapri since congestive heart failure only gets worse with time. Are there other medications for congestive heart failure? Yes, there are, and your veterinarian will determine the right medications for your dog. However, I avoid any congestive heart failure medication that increases the dog's heart rate or heart muscle contractility. Why do I do this? It's like asking me at my age to run a marathon. I can assure you I'll just collapse on the way. I have had dogs on this one such medication that kept on fainting due to heart fatigue. So why does the heart eventually stop beating? Because it's too weak to pump and circulate blood through all the body. That's the end of the video. If this video was helpful, subscribe, share it, comment, or ask a question below. Thank you for watching, and see you in the next video.